Ladies and gentlemen, filtered project financed under EU for Health program has its aim to stimulate collaborative advocacy for the prevention of non-communicable diseases. It is important that the program has a special focus on alcohol, tobacco, and unhealthy foods and drinks by uniting and strengthening civil society. While the initiative was launched in the context of the European Beating Cancer Plan, it remains equally relevant for the upcoming cardiovascular plan. Cardiovascular diseases such as heart disease and stroke are leading cause of death in the EU, representing 37% of all deaths, with more than 5 million new cases of CVD diagnosed annually. For women, the situation is even more alarming. A woman in the EU is almost twice as likely to die of cardiovascular disease than all cancer types combined. In addition to the terrible human cost, cardiovascular disease places a staggering economic burden of 282 billion euros on the EU every year. Diabetes, as a related condition, is also a huge public health challenge. It affects over 36 million adults, as well as around 300,000 children and young people in the EU. Around 1.6 million of these people live with type 1 diabetes. Overall, the numbers are rising rapidly. In fact, they have nearly doubled over the last 2 decades. So time to act at EU level is long overdue. For the first time, we are developing an EU Cardiovascular Health Plan, which will be adopted by the end of this year. The plan will pay particular attention to diabetes and obesity, as they are closely related to cardiovascular health. This plan will cover prevention, early detection and screening, treatment and care, including rehabilitation. And it will have a special focus on developing health checks for diabetes and cardiovascular diseases to identify people at risk. And yes, we will address commercial determinants as well. Following the proposal for increasing tax rates for tobacco and nicotine products, we will conclude the evaluation of the tobacco product and advertisement directives. The evaluation will be followed up by a revision of this legislation. The Cardiovascular Action Plan will foresee action on unhealthy food, such as highly processed food, and will envisage actions on alcohol as well. Ladies and gentlemen, in all these efforts, we count on the contribution of the civil society. No matter how limited the current budgetary capacities are, working with NGOs will continue on projects where they have an added value. This way, civil society can continue to be part of the European health policy landscape, and our cooperation can continue. Because together we can make a real change. I wish you a fruitful discussion and successful conference. Thank you.